Yes, as we take talk for the other end, there say we go dey join Dr. Barth here because health she koko, health she pataki. That is dey very quintessential. Health is wealth. Yes, or anything wey person gets, if health no dey there, na zero. Because the person wey dey alive, na they enjoy life. So therefore, so it's very pertinent we take charge, full charge of our health. That's why we create this show we call Health Matta. Slimity day here, Dr. Barth day here, and I will say good morning once again to you esteemed viewers. Good morning, sir.
Yeah, good morning.
You're welcome to the show, sir.
Pleased to be back.
Yeah, you're welcome, sir.
Slimmest of them all.
Good morning, doctor. Good to have you again.
It's been raining cats and dogs today.
Days now, doctor.
Yeah, thank you very much. Good morning, viewers at home and around the world. I'm Dr. Barth Ufoegbunam of Grace Valley Medical Center here in Lagos. This morning we'll be looking at measles. It was a topic we started last week. Okay. Now, measles is something that is common in our environment. Measles is an infection that a lot of us know at least a thing or two about. What is measles? It's a highly contagious viral infection that is usually more pronounced in children, but can affect both children as well as adults. At the moment, we have a global epidemic of measles, almost touching many countries of the world. Top on the list is the fact that it has affected US. This was a country that has been able to eliminate measles since the year 2000. At the moment, I can tell you the latest report that was out as of yesterday has it that a total of 971 people has been affected with measles.
In Nigeria?
No, not in Nigeria. In the USA, US alone.
The same US you told us last week, say they take charge.
In fact, as of last week, it was 880. So between a week and some few days, it has gone up by 91 cases have added up to what they had before.
What could they adduce to be the reason for this sporadic growth? Because we know them, say over there,
they combat
diseases and they get every apparatus to make sure say the same. So what did they happen? Or should this actually create a fear to us if the so-called Western nations are suffering this? How about us?
I want us to take it from this aspect. If the fear can make us able to do the right thing as a country, as a continent, talking about Africa, that will be a welcome development.
Good for us, you say?
Yes.
Okay.
If the fear can actually enable us or spur us up to do the right thing. Okay, I can tell you that even in the US, where we have sporadic outbreaks, that is not to say that we don't have in Nigeria. We'll still come to our own. But let's start with developed countries of the world.
Papers are even aware of it.
Yes. So, a number of reasons, to answer your question, sir, have been adduced that might be responsible for the sporadic outbreaks that are currently ravaging the world on a global scale. Number one is the fact that travelers from areas where people were not vaccinated can actually bring it to a country that has a high level of coverage, talking about vaccination now.
That's the issue of migration.
Yes. That's one of the reasons. Number two is the fact that there's a lot of nonchalant attitude by individuals concerned.
Even in the Western world?
Even in the Western world.
Wow.
Added to that is the fact that some population or some significant, I won't want to use the word significant population, but pockets of individuals have refused to avail themselves of vaccination opportunities, even in the US. So top on the list was said to be a Jewish community or some Jewish communities that can be found in New York City as well as I think Rockland County or something like that, where it's being said that they have up to 90,000 Jewish community residing in that part of the world. Okay, so now why are they rejecting this vaccines or vaccination? It's because of the fact that a few years ago there was this news that has been debunked scientifically now that vaccines was implicated. Okay, in the course of autism that can be found in some newborn. Okay, or that can. Autism is actually a form of congenital malformation that affects is a developmental malformation that affects children. Okay, so somebody
autism is the same with Down syndrome. If I'm
Caustic.
Very correct, sir.
Okay, sir.
Now, something close to that. Okay, so years ago, people were linking vaccines to the development of autism, but all of these have been debunked now, scientifically debunked. So no such thing exists, no such association exists. And I can tell you that not just in US alone that you have people refusing to avail their wards or their children or even themselves of this all-important vaccination. Permit me to also say that usually anybody who gets vaccinated against measles, okay, if you're able to get at least the first vaccine against measles, okay, now the newer recommendation is that people should be vaccinated at least twice. When we talk about vaccine, we are talking about MMR, measles, mumps, rubella vaccine, which we have in Nigeria environment and a number of countries around us here. Now, what happens is that the one we are used to in Nigeria is the one that usually children take at the age of 9 months.
The first one, yes.
It's taken as a single dose, okay, usually at the age of 9 months. Okay, but any child who has had that at 9 months age can actually have a second one within the age of 4 to 5 years of life. Why is this so? In 1989, US witnessed an outbreak of measles infection, even among vaccinated school children. Okay, so as a result of that, the Advisory Committee on Vaccination in the US, alongside American Academy of Pediatrics and American Academy of Family Health Physicians, actually came together and then took a decision to recommend a second dose of MMR. Okay, so ideally, the first MMR should be given by the age of 12 months to 15 months of life after a child's first birthday. And then the second dose can come up at about 4 to 5 years of life.
Okay, that means
adults too cannot equally be immunized.
But I wanted to ask,
as an adult,
do I stand a
sure,
risk of getting measles if I have not been vaccinated?
If you don't have a documented evidence that you've been vaccinated as an adult, you are advised to go and receive at least a dose of MMR, which can actually confer 93% of immunity. But if you're able to receive the 2 doses, or any child who's able to receive the 2 doses can actually have as high as 97% immunity.
So now I'm on 90%.
Let us domesticate this before we open the phone lines. Make people wait there so that we go to the same page with them. All being said and done, yes, we know we need to get the vaccines, and you've told us that we will get on 2 times. But quickly, I want to ask doctor, this vaccine, waiting be the cost implication, because most of
and even the second one, is it really available? I'm aware of the first one, but the second one,
be the
not for you.
Cost implication, that's one. Then number 2 is where can we get it? Is it only in private hospitals, or if we walk into any healthcare center and get immunized?
Thank you very much for that very important question, I must point out. Now, the vaccines are available in virtually all government-owned hospitals, as well as a good number of private hospitals. Okay, they have it. And I also would like to say that the one that we usually give, the single dose that we usually give at the 9th month of life, is actually among the routine vaccines that a child within that age group should actually have. And I also would like to add that it is free in most government hospitals. Even in private hospitals where they take a stipend, is not usually more than 500 to 1,000 naira. So we do not have any reason why we should not allow our kids to have this vaccination. Now, I can tell you that in 1997, according to UNICEF record that was released, Nigeria had over 4 million, or about 4 million children that did not receive first dose of measles vaccine.
That's wrong.
First dose of measles vaccine. And of course, what we need to eliminate or to eradicate measles all over the world, don't forget, I think someone asked me a question on smallpox.
Yeah, last week, chickenpox.
I asked, so somebody asked me.
Yes, also asked a question on smallpox. Now, I want to draw an analogy by mentioning smallpox. Smallpox was equally a deadly viral infection that was killing people years back. Okay, that should be decades ago, about 40 years ago. But as we speak, since 1980, the world has been able to eradicate smallpox. At the moment, smallpox does not exist anywhere in the world. The only place where it was, where I understand or I read it was reserved, can only be found in 2 laboratories, Atlanta, Georgia, and in Russia. That is where they kept they kept the virus that causes smallpox. Other than that, you can't get it anywhere in the world. Okay, so if eradication of smallpox was possible, eradication of measles can equally be possible because, number one, they are both vaccine-preventable diseases. Now, if they are vaccine-preventable diseases, if we're able to create what we refer to as herd immunity in our communities, in our states, in our countries, in our continents, that will help to eradicate, not just eliminate measles as we currently, or as was done in the US. This vaccination is safe. Everybody should be encouraged to take it. Enough of vaccination. Let's quickly, for viewers who may be joining us for the first time, let's quickly give a rundown of the presentation of measles. Okay. Now, we have said at the beginning that measles is a highly contagious viral infection. Okay.
Airborne.
The presentation or the usual symptoms of measles. Number one, prior to the appearance of rash, okay, the person could have fever, runny nose, nausea, malaise, as well as conjunctivitis. Okay. Now, the type of cough that they present with is referred to as hacking cough.
What do you mean hacking cough?
Hacking cough. It's just a characteristic of the cough. Sometimes we talk about, we try to define coughs in terms of the different characteristics associated with one particular disease or the other. Just like you hear,
TB cough is
and then you had also whooping cough. And then usually at the end of such a cough, the person gives a whooping sound. Okay, so sometimes medicine tries to differentiate all of these by associating one form of characteristics to each other. Now, permit me to also mention that among the things that you may find in someone who has measles is what we refer to as Koplik spots.
What's that?
Spots? No, yes.
Is it those spots?
Is it regular spots?
No, not the one on the skin. Within the buccal cavity, within the mouth.
You showed us something like that
Okay,
last
so
week.
we showed some pictures, okay, which we might see today. Okay, now, the measles virus usually stays within the upper respiratory airway. Okay, so that means that any individual that has measles can afford to infect people around him by just coughing, sneezing into the atmosphere. So it is contained in the respiratory droplets that such an individual can actually cough out.
Yeah.
Last week, you also said that someone who has measles can actually cough and sneeze in an environment and probably leave the place. 2 hours after the person has left, someone can even come in. A new person who may not have known that such has occurred can actually come in 2 hours after. And then when you breathe in and the air in such an environment, you are capable of getting infected, especially when you are unvaccinated, when you're not immunized. In fact, it's being said that for people who are not vaccinated, who are not yet exposed to measles, if an infected person is around them, about 90% of people around such one infected person can actually get the infection, meaning that 9 out of 1 can be infected, usually if they are unvaccinated. Okay, and one single person can infect as many as 18 others. Okay, so it's a highly contagious viral infection. Okay, now having said that, going back to the symptoms, usually after the first symptoms, few days after, you see a rash, very characteristic. You can't miss it. That is why our mothers in the villages can actually make the diagnosis, and most of the times they're always correct.
If not for the rashes.
Yes. Now the rash is unique in that it starts from the hairline. Starts from the face, the head, moves to the upper trunk, and then the lower trunk, and then the extremities.
Comes out gradually.
Yes. And then usually the rash is flat red spots. And sometimes they could come together, different from what you can find in chickenpox, which of course is the closest. Last week we tried to point out 1 or 2 differences between the rash that can be found, or the differences between chickenpox and measles. I think it would be nice for us to just say a thing or two about that. Now, the rash in chickenpox is usually scattered.
And I think it's bigger.
not only is it bigger, in measles we said
it has water in
yes,
it.
yes. It contains blisters. And usually, when you itch, it comes with itching. So one is tempted to scratch on those blisters, and by so doing, it's spread in one, and as well as forming, it could make those areas of the skin to be scared, so that much later in life, when the person must have gotten over the disease,
you are always almost left with a scare. In fact, I still have my.
So you still see the telltale signs on such people. Yeah, thank you. Now, but having talked about rash, both of them can actually present with fever. Okay. In measles, we said you could have Koplik spores. In chickenpox, you may not have that, though you could have sores in the mouth, but that cannot be Koplik spores. Okay. Usually, we say in medicine that Koplik spores is pathognomonic, exclusively characteristic of a particular disease entity. In this case, measles. Okay. Now, two. There's also a difference.
Sir, just for the sake of knowledge, for epistemological sake, fever,
go ahead, sir.
high fever, and malaria. Is there any difference? I thought you said it's when somebody is having high temperature that is.
Fever is just. Thank you very much for that question, sir. Now, let me explain it this way, because sometimes we see this very often in the consulting room. A patient walks in, doctor, I want to be treated for fever. Okay, so I think I need to make an elaboration on that. Fever simply means elevated body temperature, high temperature. Now, what that happens is that fever is actually our body's defensive mechanism of trying to combat a disease. Now, the body realizes that at high temperature, some of these diseases will not thrive, will not be able to thrive. So what it can do, in a situation where it has a challenging situation, it will raise the bar.
Wow.
Fantastic.
It's even to our own advantage.
Yes.
No, we are feeling uncomfortable.
We're actually not only the one feeling uncomfortable, those pathogens are equally feeling as uncomfortable as we are feeling. Yes, because when that heat is elevated, they cannot thrive. So it's a body's defense mechanism. And by the time you put a clinical thermometer, of course, you pick that as elevated temperature. That is what fever is all about. But Malay is just talking about, is an English word though, Malay is just talking about general feeling of unwell.
Malaria.
No, not malaria. General feeling of unwell.
Okay.
You're feeling sick.
Okay,
so that's Malay.
Dehydrated, as if you know if you carry your body.
No, dehydration
is water, Nabi.
Yeah, loss of
water.
fluid. Okay, usually, oftentimes you can elicit that by seeing sunken eyes. In newborns, you can have a sunken fontanelle and then dry skin, okay, with loss of skin turgor. Okay, but that's about that. Okay, so going back to the symptoms, usually the rash, one is contagious 4 days before the appearance of the rash, in measles, and 4 days after the appearance of rash in measles. Okay. Don't forget, we're trying to make comparison between chickenpox and measles. Well, what you have in chickenpox is that one is contagious 2 days before the appearance of rash, and one is contagious until those spots begins to form, to get crusted over, begins to form crusted. The blisters will burst, and then at the end of the day, start forming scabs. So you're contagious even up to that moment. But in measles, your time of being contagious can be said to be within just 8 days.
I think Dr. Barth has gone so carried away that we've not opened the phone line. So
I think we should do
that. We enjoy the show, and I believe you yourself they enjoy them. We enjoy them, so we never even open phone lines. So please, the phone lines are open. Feel free calling. First and foremost, turn down the volume way down on top of your TV set. Well, there's serious evolvement in the world. Doctor, that video we will see, measles can no longer
it does not
happen here.
2015.
That was 2015.
That was like how many years ago?
That was 2015.
Now 4 years after.
That was 2015.
Should we see it as carelessness on their part?
I think he ended up that statement with an air of arrogance. But he met
that's the point. I want to try to make you talk about
size.
No longer. And that. Okay, but you see it in the tone.
Yes. What he was actually trying to explain is that usually, for you to declare a country, for you to say a country has eliminated, not eradicated though, for you to say a country has eliminated a particular infection or disease entity, what it means is that there will be no new case, no new history of that disease originating from that country over a period of 12 months. Okay. And I can tell you that that status, that US is about to lose that status as we speak.
I didn't know those
if urgent measures are not put in place, which they are currently doing, by fall, okay, that's after summer. They're in summer now, so a lot of people will be traveling from one place to the other. So the few of those concerns can actually help to spread the disease even more. Okay, so, but if care is not taken, it started in US in October last year. It hits October this year, they will lose that status of having been able to eliminate measles in their shores. We have Zubi from Delta. Zubi, good morning.
Good morning, Zubi. Good morning, Zubi.
Good morning.
Your voice is too low. Please speak up.
Hello, good morning.
Better.
Good morning. Good morning.
All right, get a question for doctor.
Yes. You were talking about measles and
please.
the disease. But I remember then when I was 8 years, I had measles. So my mom gave me the disease. So why did I contact it? Of which I'm thinking we said that 90% of, or 97%, the disease is more strong. So I don't know. Why did I contacted it then when I was 8 years? Of which my mom gave me the disease then.
Thank you very much for that very important question.
Okay.
Okay. Now, if you were listening from the beginning of the program, I think somewhere along the line I actually pointed out that there was an outbreak in the US in 1989. Okay, among children, preschool children who have received the vaccination for measles, the first dose. Okay, now as a result of this discovery, that even among people who have had vaccine, how come they're having it again? Don't forget, we said with the first vaccine, you have about 93% immunity. But if you're able to do 2 doses, you have about 97%. So that was actually the beginning of dual vaccination for measles. Okay? Now, the bodies involved, organizations involved, came together and made that recommendation that people who have had measles vaccine 1 to actually go for measles vaccine 2 to be able to have 97% of immunity. That explains the reason why you were immunized, yes, at the 9th month of life, and then you still ended up having measles. But let me also give you a good news, that since you've had measles, you're not likely to have it again in your lifetime. Okay, but you should ensure that not just the people around you, your children, if you're already married, people in your city, your village, you should ensure and encourage everybody to go for the vaccine. Yes. Because I tell you, if we're able to do that, we will be able to increase the herd immunity in our communities. And by that, it will be difficult for measles to thrive. Yes. Okay? That is what they had in the US that helped them, not just US, and other developed countries of the world. US is not the only one the only country that has been able to eliminate measles from their shores. A number of, I think the whole countries in Americas and 24 or so of European countries have been able to do so. But this current outbreak, there have been sporadic cases in a number of countries. Worst hit is actually Madagascar. Enough of US data. Can we just quickly focus on our own data in Nigeria?
Let us drive it to
Let's come home.
Let's come home to our place. Okay, so according to NCDC, Nigeria Center for Disease Control and Prevention, these are the latest figures that we have for Nigeria. As of May 18th, 2019, new cases reported as at week 19 is 2,029 cases. Total number of deaths as at week 19, only 2%. Total cases we have seen in 2019 is 28,796 cases have been seen in Nigeria since the beginning of this year. Total number of deaths that we have witnessed from, from week 1 to week 19, okay, currently stands at 89. So 89 Nigerians have lost their lives as a result of the current outbreak. Total samples collected in Nigeria was 6,394. Total samples tested so far in Nigeria is 5,976. Total samples positive. The samples that we found positive in Nigeria is about 1,423. The number of states that have reported at least 5 cases of measles in Nigeria at the moment are 36 that have reported
all
at
over.
least 5 cases of measles.
That's every
all over the
state.
Yes.
Every state.
And in the US too, about 26 states too have equally been affected. Total number of local governments with suspected cases at the moment is 660. So you can see permit me to also point
of
out
our 774 local
that
governments.
the government is responding positively.
Okay, good.
Okay, Nigerian government, not just Nigerian government. But before I go to that, let me also say what will benefit viewers at home and around the world.
Okay.
Measles is a notifiable disease.
Okay.
Notifiable in what sense, sir?
Notifiable in the sense that if you suspect, with all the things we have spoken
That you
about,
said, yes.
we have
Chidinma
Chidinma from
from
Cape
Come
State.
to
Abuja.
that. Chidinma, good morning, ma.
Morning.
How you doing?
Good.
Oh yeah, Doki day here.
Good morning, Chidinma.
Good morning.
Well done, ma. Go ahead with your question or contribution, please.
Okay, please, my question, I have 2 questions to ask.
Please
I
go
have a
ahead.
baby. He's just a year and 3 months.
Okay.
Yes. And I believe we've taken the first dose of the measles vaccine.
Yes.
But unfortunately, he started running a fever last week. And when we went to the clinic, the pediatrician said he was having measles, although I could see the red rashes on his body.
Okay, that's question number 1. Number 2, ma.
But I wasn't really convinced that it was measles because I didn't see the other signs that the doctor has mentioned here.
Okay.
Question number 2 is, please, doc, at what's the highest temperature for a baby for you to be concerned? You know, as in, at what level would you be concerned when a baby is running temperature?
Thank you very much, ma. Thank you very much, ma. Let me start with the first one. She said, a pediatrician said it was measles, and she wasn't convinced. Okay, I also had something similar after our presentation here last week. Yes, on Saturday. Okay, so a woman walked into my office, my consulting room, with a child. Okay, so by the time we reviewed the presenting symptoms, and I told the woman that what we have before us is most likely measles. Initially, she wasn't convinced. But by the time I enumerated the symptoms that are associated with measles, and then the pattern of the rash started from the head towards the trunk, and then I showed her some pictures. We were almost commencing treatment for the child because the child was having temperature and was vomiting. So we needed to take care of the supportive therapy though, because measles, being a viral infection, will actually run its own course and go and move on. Okay, so the woman came up with, doctor, our people said that they don't give injection in measles.
Which I asked
Which
last
you, yeah.
week.
Which you asked last week. And my argument with her was that, okay.
Why?
No, it's not even why. When you didn't know about, when you didn't know it was measles, you allowed the child's blood sample to be taken, collected.
Now that I've told you.
Now I've told you, you are afraid. How did they get the blood from the child? Was it not through a prick? Okay, so after that, she wasn't convinced. By the time she left my consulting room, the next I saw was somebody driving off. For the fear,
I told you.
her only reason was that I must not allow my child to be injected, since doctor has said it's measles. Okay, so, and this is unfortunately the picture we have.
Where we
got it from.
Yes,
I don't know where we got
I don't
it
know.
from.
Where did that start
Yes.
from?
But even it's on the street.
So, but in order not to deviate from her question, the answer is that yes, your child truly may have had measles, as the pediatrician said. Pediatrician is a specialist in that field. So his or her judgment should be trusted. Okay? But the fact that your child has been immunized before led to the milder symptoms that you may have witnessed in that child. Okay? The symptoms, I'm talking about the severity now. It will not be like a child who has not been vaccinated, who has not been vaccinated, or a child who lacks vitamin A. Okay, so that's why the child could be having a lot milder symptoms than it could actually be in an unvaccinated child. Now, the second question: when should you be concerned if your child is having fever? At what temperature? Usually in medicine, we consider temperature of above 38.5 as
High.
hyperpyresia.
I remember.
No, not high.
Hyperpyresia.
Hyperpyresia. That's high fever. Okay, it could be fever, but when it gets to 38.5, we'll start
It's
talking
going
about
up
high
high
fever.
fever.
Okay, what in medicine we refer to as a hyperpyresia. So, but when you have a temperature, I'm talking about centigrade now, okay, because don't forget there are two SI units. It's either you're describing on centigrade or on Fahrenheit. Abroad, I think they use more Fahrenheit. Okay, so 40 degrees centigrade is equivalent to 104 degrees Fahrenheit. Okay, so, but a mother should be concerned when you have a temperature of 37.5 in your child. It should be concerned.
But
At least
for
you should
adults,
monitor. The same goes. You should monitor such a child a lot more closely. Okay, thank you very much for those wonderful questions.
Okay, you stopped at the issue of when that it's notifiable disease.
And you
Yes.
explain
Now,
it.
notifiable disease, what it means is that once you suspect a child is having measles or anybody around you, you should notify the authorities. Now, the reason why you should notify the health department or the local government or the health center around you, usually for us hospitals in Lagos, we have numbers to call. And when we call them, they usually come to the hospital to take samples of such a child. They will allow us to continue the treatment. Now, the essence of doing that is, having said that measles is a highly contagious disease, isolation of such a patient is important, is key. Otherwise, if you allow such a
So
child
other
to
people will not be
mix up with
infected.
other children in school, you never can tell who was vaccinated among
Or
the
not.
children and who was not.
Doctor,
So it can
doctor,
easily spread.
Doctor, sorry to interrupt, sir. When you say isolation of such a child, I want you to give us a good picture of this, because many of our viewers with their house, nobody go want make when you use the word isolation now, will it still be in your own health center, or they whisk
There's
the
a
child
place.
away, knowing full well say no parent could want make the isolating pikin, like it go be like stigmatization. That's what I'm beginning to see now.
Thank you very much.
What's the difference?
That's a very intelligent one. Why, doctor?
Well done, sir.
Thank you.
Thank you, sir.
Now, let me start by saying this. One, we have Richard from Delta. Good morning, Richard.
Say one, Richard. Oh, I think we
Richard
lost him.
won. You have to call us back the
We'll call
second
us
time.
back.
Okay, so one, when we have such a scenario on our hands, now what we need to do, okay, is number one, we need to look at what the child is presenting with, okay, to make the diagnosis. If you think the symptoms are in keeping with what the picture we have painted here, and you've been told that it is highly contagious, and you've been told that just coughing and sneezing into the air and moving out of the place can leave the space polluted. In other words, another person could get in there within 2 hours and still get infected. You have all the information on your fingertips, so it's highly contagious. And 1 out of every 4 people that ends up with measles will be hospitalized. That is to say that 3 others might be treated at home. Okay, so when we talk about isolating such a patient, it's not just in the hospital environment. The isolation too could be done at home, in the sense that for a mother who has like 3 or 4 kids and you suspect one of them has measles, even when you've not taken the child to the hospital, you need to, number one, keep the child away from others. If they birth with the same bucket, get a separate bucket for the child. Do the much you can do as a good mother, as a good father at home, because the fact is that it can easily be transmitted from one person to the other. But in a hospital setup, in a hospital setting, what we usually do is that if we suspect a child has measles and we're commencing treatment, we must admit such a child in an isolation ward. Meaning that you cannot put that child with another child
patient.
in the same room. That's the concept of isolation. Okay, so I didn't want to use the word quarantine.
Not that they will use ambulance and be carrying the child away.
No.
So that
Oftentimes, 3 out of 4 could be in their house and then come over the illness, especially people who have been vaccinated in time past. Okay, like we said before, the symptoms will be a lot milder in them. But for an unvaccinated child, the severity could be more. For a child that is malnourished, the severity could be more. For a child that lacks vitamin A, the severity could also be more. One of the things we do when we are treating measles is to give vitamin A supplements. So we'll come to that when we start talking about treatment. Okay, so, but I would like us to talk about the diagnosis of measles.
Okay.
It's important. We have talked about the presenting things we should look out for, okay? Presenting features or signs and symptoms. So now, how is the diagnosis of measles made? Okay. Number one, with the picture we have painted, if you have a child that is coming to you with that rash that we have described, or any other rash, number one is that you need to have a high index of suspicion. Okay. So you should be alerted. That should alarm you. Okay. Now, if you also notice that prior to the commencement or the eruption of those rash, that this child has had fever, is beginning to, the picture is beginning to get a lot more clearer. Okay, and then you can also ask the child to open the mouth, looking at the inner part of the mouth to see if you can have any tiny erythematous, tiny spots, usually white dots covered by a ring of red tissue. Okay, that's Koplik spots. It's not in all cases that you can see that. Okay, that should also alarm you.
Okay, Joke.
Joke from Niger. Joke, good morning.
Good morning, sir.
Yeah.
Good morning, Joke. How are you doing?
Can I go ahead with my question?
Yes,
Please
please.
go.
Okay, please. I have a small girl, a small boy. So actually, he had measles before 9 months, before the time he's supposed to be immunized.
He has a measles before 9 months, and
Yes.
he's supposed to
So I want
receive
to ask, my question is that,
immunization by 9 months.
yes, I want to ask if he's supposed to go for the vaccination by 9 months, because I heard that if you have measles before that time, they've been immunized automatically. So I want to know. And I had that measles, and I've had it before. So I now have it now when my son is having it. So I want to know, is it right? Is it supposed to be?
Okay. Thank you very much. Her question has actually opened up another set of questions along that line. Okay. From her questions, she said the child had the measles before the age of 9 months. Don't forget, we've talked about vaccine. There are contraindications to receiving measles vaccine. And one of it is that you don't give it to a child younger than 9 months of age. Okay? Now, unfortunately, that's a dilemma. That's why we say that parents need to be a lot more careful with the environment they take their children to. Okay? Especially in school. Teachers and principals, proprietors should also be up and about, so that if you discover any
Child with measles,
rash, not even measles, any form of skin infection in any child, should send the child home, call the attention of the parents, so that the child can be taken to hospital for proper treatment. But now, going back to our question, because it's unfortunate, because otherwise a woman is as exposed and educated as she is, must have taken the child for immunization as at when due. But unfortunately,
the child never reached 9 months.
Yes. So we said at the beginning that anybody who has suffered measles is not likely to have measles anymore.
Yeah.
So it confers a lifelong immunity. So if you like, as a natural vaccination for such a child. Okay. Now, but that said, people who have been vaccinated, like we said at the beginning, once can equally end up picking up measles. That is why the second vaccination is recommended at 4 to 5 years, going by WHO recommendation now. Okay. So that's all I can say about that. Okay, but still on diagnosis, I don't know how much of time we have.
Maybe can we just start from that?
We should just start from there next month. But for this woman now, the child has not actually been vaccinated before 9 months.
Already having, can they still go for it? Can they
still go for it before 9 months now?
There's no need for the child that suffered measles. If she was sure that it was measles that the child had.
Because she has come down with it.
So the child will have a lifelong immunity. So why preventing what will not come back again? What is not likely to come back again?
So the child can only be treated normally for measles.
Yes. Once the child has survived that one, the child is not likely to have measles again in his or her lifetime.
I think that's the good news. So on top of that, we need to wrap up. We need to say thank you very much to you, our esteemed viewers. They always stay tuned. Plus, Dr. Barth will always make a day with us.
Thank you very
sir.
much,
Thank you
Chief.
for coming.
Thank you very much.
Thank
sir.
you.
Thank you.
So best of them all.
Yeah, thanking me for. Okay, guys, I'll see you again 1 to 2 on top 5.